In our first video for this section, I told you a little bit about antibiotic resistance and the timeline. So what are the specific threats that we as the public should worry about, that our healthcare providers should be worried about? And those specific threats are really listed here. And these are from a list published by the CDC, so the Centers for Disease Control and Prevention, every few years publishes an antimicrobial resistance watch list. And so the last time they published this list was in 2019. As you might imagine, they were pretty busy in 2020, 2021, 2022. So they did publish a supplement a little bit more recently, kind of updating some of the numbers, but the overall threats are really the same, except what the CDC had predicted was they predicted that because more people were staying home because of COVID, that the numbers of antibiotic resistance would go down. In fact, what they saw was actually the opposite. Because people were going to the hospital with COVID, the numbers of antibiotic resistance actually went up significantly. So what are considered to be urgent threats, just some bacteria in general, like Clostridium difficile. This is like C. diff. It causes diarrhea. Drug-resistant gonorrhea is a sexually transmitted infection. A fungal infection called Candida aureus. Carbapenem-resistant Enterobacteriaceae. This includes E. coli, Salmonella, Shigella, and carbapenem-resistant Acinetobacter, which is another bacterium. So urgent threats. These are like top-level, most scary things to the CDC. After that is drug-resistant Campylobacter, which is another gastrointestinal infection, another fungal infection. These other Enterobacteriaceae, same bacteria like E. coli, Salmonella, Shigella, that are resistant to not as significant a class of drugs. Salmonella, Shigella, MRSA, strep pneumonia, tuberculosis. Other concerning threats include Group A strep. This is Streptococcus pyogenes, which causes strep throat. It's becoming drug resistant, which means that strep throat can kill you. And then also Group B strep. This is an infection that's really important in pregnancy, because if a child or an infant is born to a mother who's infected with Group B strep, that infant can experience consequences, from meningitis all the way to death. So it's very important that we not have drug-resistant Group B strep. Things that are coming up on the watch list include another fungal infection. This one causes kind of like a urinary tract or, sexually transmitted infection. And then Bordetella pertussis, whooping cough, drug-resistant whooping cough. And when people are not keeping up with their vaccines, right? Remember, you're supposed to get a Tdap booster every 10 years. The P part is Bordetella pertussis, so you're supposed to get that every 10 years. If you don't, and you get whooping cough, they're now seeing drug-resistant whooping cough, so that's very scary as well. And then I like this comic, the person's taking antibiotics, the bacteria is dying, you hold on, the human didn't take the full course of antibiotics, you're gonna make it, right? So it's really, really important that you take your full course of antibiotics. And again, which patients are most at risk? Overall, a general healthy individual who gets an infection is probably going to be fine, even if that infection has some drug resistance. But what we really worry about are patients who are already compromised, and that would include our cancer patients, patients who've had complex surgeries because these bacteria can infect surgical wounds, patients with rheumatoid arthritis and other autoimmune conditions, patients who are undergoing dialysis, and patients who've received organ and bone marrow donations, because especially when you receive an organ transplant, you have to take drugs for the rest of your life to keep your immune system from attacking your new organ. So you'll always be immune suppressed. And for bone marrow donation, they wipe out your whole immune system by killing all your bone marrow until your new bone marrow takes hold. So all of these people are at much higher risk of dying from these drug-resistant infections. And so what do we see in terms of numbers in the US? Remember, these numbers are a little bit out of date because they're from 2019. It's the most recent full publication the CDC did. I imagine in the next year or two, they're going to do another full one. So in 2019, antibiotic-resistant bacteria and drug-resistant fungi caused almost 2.9 million infections per year and 36,000 deaths. And so again, these are people who maybe they went to the hospital for something else, but they died of the infection. Like, oh, I went to the hospital to, have knee surgery, or because I had, pneumonia, but I got a different infection that was antibiotic resistant and died. And then they combine that with people who've gotten C. diff, because we mostly see C. diff in patients who took antibiotics, then they develop C. diff. Nearly 250,000 cases of people who got C. diff after taking antibiotics, and almost 13,000 deaths. So if we combine these, what we're looking at is over 3 million people who either got a drug-resistant infection or an infection because they took antibiotics, and like almost 50,000 deaths. So it's a really, really impactful phenomenon. Worldwide, the UN has an ad hoc group studying antimicrobial resistance, and they estimate worldwide 700,000 deaths per year, and about 230,000 of those are from multi-drug resistant tuberculosis alone. In terms of the financial impact of like the cost of treatment, the inability to work because you're sick, they're estimating that within the next 7 years, an additional 24 million people worldwide will be forced into extreme poverty. And then this statistic here, by 2050, so in 17 years, 10 million people a year, right, from 700,000 to 10 million, could die from antibiotic-resistant infections. This number right here, worldwide, is more than the number of people who die from cancer every year. So infections will kill more people than cancer every year. And again, the future, it looks pretty bleak. So you have, Mycobacterium tuberculosis, so drug-resistant TB, increased morbidity and mortality. So morbidity is like illness, like the inability to do things because you're sick. Mortality is obviously death, increased costs, and threatened disease control. Drug-resistant malaria, drug-resistant HIV, drug-resistant flu, threatened disease control, increased morbidity and mortality. So then the question becomes, well, why don't we just make new drugs, right? New antibiotics. And again, this data is a little bit out of date. I couldn't find a more recent table, but you see the number of new drug applications for antibiotics, and it's decreased every time. So why does it decrease so much? Well, companies that make drugs, or any company, a company exists to make a profit. Antibiotics are not terribly profitable. Why are they not profitable? Well, how long do you take an antibiotic? Let's say you take it as prescribed. 7 days, 10 days, 14 days. In some extreme cases, like with tuberculosis, maybe a few months. And then, how often do you take these drugs? I actually just recently had to take some antibiotic eye drops because one of my kids literally scratched me in the eye. But I haven't taken antibiotics since I had my kids. So when I had a C-section, so they gave me some antibiotics to prevent infection. So in 2.5 years, I've taken antibiotics twice. But before that, it had been probably 5-6 years since I'd had to take an antibiotic. Maybe even longer. I can't remember. So over the course of my lifetime, I could probably count on 2 hands the number of times I've had to take antibiotics. That's not very profitable. when I could make a drug for something like low cholesterol or depression or erectile dysfunction that patients will take for the rest of their lives. It's just not profitable. It's not worthwhile. So what we're, again, looking at is this post-antibiotic era. And the director of the World Health Organization says, a post-antibiotic era means, in effect, an end to modern medicine as we know it. Things as common as strep throat or a child's scratched knee could once again kill. And again, this is a little bit of an older statistic, but in the US, one person dies every 15 minutes because of drug resistance. I would argue that that number is probably, faster now. Maybe one person dies every 13 minutes because more people are dying of drug-resistant infections. And I don't mean to be all doom and gloom. I guess in a class called Killer Microbes, doom and gloom is kind of what we're looking for here. But okay, I'll try not to be doom and gloom for the rest of this video. So what can be done to reduce antimicrobial resistance? Well, take your drugs only when necessary. And so what I want you to think about as you're, again, commenting on this video, as you're studying for your exam, when would you not need to take drugs? When would you need to take drugs? And so think about that. Again, the majority of you are not science majors, so you're not going to go and be a doctor, but you are going to be informed citizens. And so when you do go to the doctor, you'll know what to ask for and you'll know what not to ask for. Always take the recommended dosage. Don't take less. Don't take it for a shorter amount of time. Take what's been recommended. Follow the course of treatment that has been recommended. And I recently traveled to Mexico with my family, and they have the pharmacies, and they're like, here, you can buy penicillin. Do not buy penicillin at a pharmacy in another country. Not that their penicillin is bad. I'm sure their penicillin is effective and it works very well, but you haven't been prescribed penicillin. So don't buy it. And don't buy it just in case you are prescribed penicillin later. It loses its effectiveness over time. So instead of killing the bacteria, it'll just show them, oh, what penicillin looks like. Yeah, cool. I've learned. Right? Only take drugs when they've been prescribed to you, antibiotics and otherwise. And so then, I'll end on this note. This is the Halloween costume I always think I'm going to do, and I never do. So what are you supposed to be? I'm an unfinished course of antibiotics. I can lead to antibiotic resistance. Aren't I terrifying? And she was never invited to a Halloween party again.